I'm Kate Michael. Today we're at the offices of dermatologist Dr. Tina West of the West Institute for Skin, Laser, and Body Contouring. Today we're going to be talking about the hot new rage of non-invasive facelifts. Dr. West, what can you tell us about this procedure?
Well, I like to call the procedure facelift in a syringe. And it's a procedure that I've developed over the years in which I use volume replacement instead of surgery to strategically fill hollow areas and lift sagging skin. My practice has always been about maintenance to avoid drastic surgery.
And why would that be so appealing to patients?
Well, patients these days tend to be very into a healthy diet and working out, and they want to look as good as they feel. So a non-invasive procedure that can not only fill in lines or wrinkles, but also restore the youthful contour to the face is very appealing. And this is the type of procedure that actually makes people look younger than their chronological age.
Well, why not just get a facelift?
That's a very good question, and I've seen, of course, many patients with facelifts over the years. And while the facelift procedure does get rid of sagging skin, the patients are still left with gaunt eyes, sunken temples, and kind of hollow cheeks. So they still look their age, and they still have the sunken areas and the volume loss, even though they've gotten rid of the excess skin.
So getting a facelift doesn't mean that you don't have to worry about your face for the next 5 to 10 years?
Yeah, absolutely not. Even the patients that have had facelifts need to come into the office to get their frown lines relaxed with Botox and to get the volume loss replaced with fillers like Juvederm.
So what makes facelift in a syringe unique?
Well, my non-invasive technique that I call facelift in a syringe looks very natural and beautiful. And it's a procedure that's done in the office. It can be done over a course of several treatment sessions, so the enhancement looks very natural. And what patients really love about it is that no one knows they've done anything, they just look more refreshed and youthful. There's no hiding out from colleagues or friends.
Well, Dr. West, I see you have a patient here today.
And this is Beth, who was kind enough to come in today. You can see that she takes great care of herself. She's fit, she's thin, but she does have these areas of volume loss in her face. Unfortunately, that happens to all of us as we age because we lose fat and collagen. So over time, these areas that become a little bit hollow and sunken also lead to more prominent creases in the skin, and they look a little bit deeper over time. Okay, so what we're going to be doing now is marking out the areas that will be filling in to restore the more youthful contours. And Beth has brought in a picture of herself from about 20 or 30 years ago. So this procedure is going to fill in these areas that have hollowed over time. And when we look at that picture of her from several years ago, we can see that we're just restoring volume that she's lost. We're not going to make her look any different, just a fresher version of herself. So I'm going to have my assistant Tracy go ahead and clean her off, and we'll put on some numbing cream so that she'll be more comfortable during the procedure. So right now, I'm injecting Juvederm Ultra Plus. You okay, Beth? Mm-hmm. Okay. Which is a natural sugar that's normally found in the skin.
Dr. West has finished the procedure. Let's take a look at Beth's before image. And let's take a look at Beth now. How do you feel?
I feel great.
Fantastic. Tell us what happened.
Well, as you could see in the before photo, there were some areas that were hollow and sunken, giving a little bit of a sagging or drooping effect. So what we actually did was we had Beth come in about a week ago and did some Botox to relax the facial muscles and kind of prep the canvas. And then today we put in some fillers, Juvederm Ultra and Juvederm Ultra Plus, and just enhanced the cheek area here. We put some in to define the jawline and even some sunken areas in the chin. A little bit right here to complement the Botox that she had. We even did a little bit under the eyes and a tiny little bit in her upper lip, because even though we think of upper lip enhancement as looking too full and not real, what we did was just put in such a little bit that it just makes it look like the photograph that she had brought in, just to subtly get it back, because since we lose the volume over time, the lip's also thin. We just put back that little bit to give it that subtle enhancement. And so as you can see, she got an all-over lifting effect just by adding that volume.
Well, it sounds really customized.
Yep, and that's what makes it so unique and exciting, because actually I take the natural architecture of each patient's face and use that as a guideline and then tailor it to each individual patient based usually on a photo that they bring in of how their face has changed contour over the years since around their 20s.
I can't believe the transformation that I've seen in just a few minutes. Was this why you would come in and do it again? What was your reasoning?
I would absolutely do it again. Very little downtime is needed, if any, and it's very natural.
It certainly is natural. You look fantastic.
Thank you.
Again, I'm Kate Michael. More coming up after this.